Welcome to the Shift Report, the podcast from MCentric and the MCentric Foundation. MCentric is the go-to information and resources hub designed exclusively for the emergency medicine community. We regularly host key leaders from the field who share their insights and experience. Our goal is to inform our listeners and to encourage you to use what you learn to improve your practice and improve yourself. To learn more, please visit us at mcentric.org. Today, we welcome Taylor Coffman. Taylor is not sort of in the norm of some of our guests in the past, but is an actress and a patient advocate who you can find easily online, telling her story from a medical perspective, from what a long and probably painful experience with the healthcare system based on a severe and rare illness, and how she's come through that, and her perspectives on being a patient and interacting with the healthcare system, and how that has now turned to advocacy for those with rare diseases. Welcome, Taylor.
Thank you. Yes, thank you for welcoming a theater major here to your lovely program.
Well, thank you. You have a fascinating story about an unusual illness, and I'll have to admit, and I think many of my colleagues will admit, it is a condition that the vast majority of us have never seen. Because it is unusual, but potentially life-threatening. You went through a quite a storm of medical care, and have come out the other end as an advocate. Can you tell us a little bit about sort of first before all this happened?
Yeah.
What were you doing?
Yeah, I think, I was a very healthy, I was an actor. I'm also a writer. I was working, and I worked in late night television, and then eventually worked for LA's public radio station, their NPR affiliate. And it became time to have a baby. And I and my husband had a fairly normal pregnancy experience. I will say normal in the sense that it's always somewhat of a journey being pregnant, but we nothing flagged. Essentially, I got great prenatal care, and they always were checking up on me. But when I went in to get induced, about 3 days in, it was quite clear that I wasn't dilating. And so my baby's heart rate started to look not amazing. So it was very clear cut. Okay, I need to go in for a C-section. Moments after the C-section, they're taking care of the baby. I actually haven't even seen the baby yet. They're monitoring me, but mostly watching the baby. I had one nurse sort of hovering over me, and alarms start going off. And at first, she kind of checks on me, and she goes, "Well, they're very sensitive." So she sort of turns them off and goes back to the computer. And then they just keep going off. And at one point, I just saw her face. And I think, as anyone knows, usually when you're in a hospital, you're sort of used to your doctors and your nurses not looking incredibly panicked. And I just saw her face turn white, and she kind of leapt up. Suddenly, all these doctors swarmed around me. And actually, and you probably know way more about the science behind this, but one actually it looked like her cell phone over my abdomen. And then immediately they were like, "We got to get her back in." I was internally bleeding at that point and hemorrhaging. And so I grabbed my husband's hand, said I loved him. And then he was out, and I was being brought back into an emergency surgery. They could not figure out where I was bleeding from. It was a very, I was the kind of surgery that my God bless my doctor, she had to take a few days off afterward. It was that scary. And luckily, they were able to stabilize me, but I ended up triggering, I'll give away the headline. I ended up triggering what's known as atypical hemolytic uremic syndrome, although there is a movement right now to change the name. So physicians may hear more of it being called. For me, I believe it's pregnancy-induced complement-mediated thrombotic microangiopathy. So essentially, tiny blood clots caused
Yeah.
by my complement system. So I normally say that for all the laymen who might be listening in. So essentially, my kidneys failed, and the blood clots were so rampant in my body. I had them in my heart, in my lungs, all over my pelvis. Thankfully, my baby was fine. She had them throughout her cord, but it was a miracle. She was fine. But I was not so fine. And as they were trying to determine what was going on with me, whether it was help or something else, you know, labs going flying every mile a minute, I was getting worse. Like I wasn't waking up from anesthesia. Luckily, they brought in a nephrologist because I was in the ICU at this point, brought in a nephrologist who identified that my blood work looked a little, I would say, low platelets, and lots of cell destruction. So luckily, my hematologist checks his emails on a Saturday morning and alerted, luckily, there is a treatment for this rare disease, eculizumab, and basically said she needs this drug. My husband spent an entire day basically trying to figure out anything about this drug so he could approve its use because it's very powerful.
Right.
They could get me the drug, but that unfortunately was not at all out of the woods at that point. I still had a lot of body injury. I ended up getting pneumonia and sepsis and even a day in I had hypoxia because my lungs just kept filling up with fluid because I was having kidney failure. I was in and out of the ICU in all told in the end three different times. I was on a ventilator 3 different times. At one point, they just put me in a coma. They just said, "We're going to give this woman a few days." But my husband got a call during that period when I was out, and they gave him that sort of sobering late night call that was like, "We just don't know if she's going to make it out of this, and maybe prepare yourself." But luckily, I did wake up, and I would say even though that's still very much the middle of the journey, I think at that moment it symbolized sort of this, like, I'm no longer going to be passive in this experience as a patient. I at that point very much started asking more questions, trying to get my physicians aligned. And I was one of my day jobs was as a project manager
Hmm.
at the radio station I worked at.
So
And it's
you had a project to do.
yes, and I was like, oh, when people and because my case was changing, not like every 4 hours, but sometimes every hour. And often my chart was so long, it's such a long time to catch up. So I basically said I didn't feel like everyone was communicating well enough with each other because also they'd come see me, they'd say different things, they'd have different ideas about the prognosis, about the steps ahead. And I just wasn't getting better. And thank God, one of my doctors was like, I'm going to be the quarterback here. And he got everyone organized in a communication chain, and they were way more proactive. They had, created a system for how to care for me from then on out. I mean, I still ended up getting uremia and all these things, but I would say that at that point, did not go back to the ICU after my doctors sort of created a system to communicate with one another more effectively. Because I will say, I had the challenging case of having so many different body systems going wrong that I had almost upwards of, I would say, even 20 doctors.
Mm-hmm.
So, it's tough to have 20 doctors communicate effectively on the fly, for sure. So I'm very lucky that, everything began to be more cohesive, and then I was able to be on a path toward going home.
So this is a truly fascinating story, and there are lots of parts of this that we could probably discuss for a couple of hours each. We're not going to get to specifics of atypical hemolytic uremic syndrome. All of us know what hemolytic uremic syndrome is. The atypical part is something we really haven't seen. And I encourage listeners to go look it up because it is truly a serious illness that one should educate oneself about for the one case you might see.
I absolutely also will add, I will, especially those maternal fetal medicine teams, if you all can especially look for it because, you're not, this is something that might happen maybe once or twice a year, maybe, or even if your hospital has a TMA team, it's very rare. But, I think that's where my advocate wants to chirp up a little bit to just be aware of this disease because luckily there is a treatment. So recovery can be really, really amazing should we get the drug early enough.
So a couple points you made, and part of the story, all of it resonates with my colleagues in emergency medicine, across medicine, otherwise. I think we've all been in the situation with alarms going off, and there's actually something called alarm fatigue in hospitals because there's so many alarms. But we've also all had that moment when it's an alarm or a look on a nurse's face that says, I need to do something about this. And it sounds like you were the patient in that moment. And
Yeah.
then through your course of a stormy multi-system organ failure course through the ICU, we've seen that in many cases. We don't get to speak to those patients that often afterwards because lots of things happen over time. And then one thing resonates, I want to, and we'll touch on, I think you probably have experienced some of this going forward, is the idea of a quarterback. Because we see this particularly in ICUs or later with patients who have multiple specialists, because particularly in a big hospital, there's specialists everywhere, but someone who is willing and able to take charge and organize the opinions. I think my intensivist colleagues would welcome that as, yes, that's what we need to do. And then also the element of shift work of people going on and off, you're being passed from one to another, things get lost in communications. And so you've probably, from your skills as a project manager, you understand how this should work and you've lived it and you've seen the benefits of doing it the right way.
Oh yeah. I mean, the results of my care after the organization, it was night and day. I mean, I was just getting worse. Even though I was getting proper treatment, I wasn't being ignored. They were certainly on top of it. But when everyone started working together, when there was cohesion, I mean, the results are there. I mean, I never went back to the ICU. I was bouncing in and out of the ICU, and I have to say though, I mean, there was one doctor who I actually quite liked, and I was in the ICU, and I at that point was just out of my coma, and I had a baby to get back to. Let's also know
Yeah,
I
you
was
were a new mom.
very motivated to live for that baby. And I just said at one point, if I end up on a ventilator again, I'm going to blame you. And he ended up really being one of the people to just really advocate for me because we as patients need you all to advocate for us almost just as much, especially when there's a big team involved. So, and also, let's face it, lots of opinions about what should happen. I had a very complex case. I had clots and a bleeding disorder. I had had severe sepsis and
Mhm.
pneumonia and needed a drug that basically kept my immune system at bay because this was not autoimmune, but complements
Right,
like the next door neighbor to autoimmune.
right.
So I had like these very dynamic situations. And once everyone was like, okay, we're gonna attack the infection first, and we're gonna get real aggressive on that, and then we're gonna give her the complement inhibitor, and we're gonna, since she's already had a dose. I was late on my second dose, so it was a little touch and go, right? But I think it ended up working and I was really well monitored. And I will say this, a lot of my doctors after this case, and maybe this is rare, we are still friends, actually. I mean, I have a Hall of Notes, I call them, my nephrologist and my hematologist. But even a lot of my other doctors who I had after that experience check in on me and keep up, and I send them pictures of my kiddo now that she's 2. So I think, and also for the residents involved, I had a lot of residents on my case, and it was, and I'm not gonna lie, like, and I don't think they'll mind me saying that I think it was an emotional journey for them. They were really rooting for me, and when I just, especially at first, was not getting better, it was, I mean, there's, I could tell that their spirits were really shaken. And I think a lot of those residents will never forget me, and getting to meet up with them for coffee, you know, 6 months later after I left was pretty special.
Yeah, that's an interesting observation, and you have a 2-year-old, so you're only 2 years
Yes.
into this,
Yes.
and that's a wonderful thing. And now you have to deal with a 2-year-old being a 2 year. Um, so we sometimes talk, the term sometimes gets thrown around, second victim syndrome, where the caregivers are become emotionally torn and involved in what is going on. You are a young woman that no one expects to get sick. And you talked about your the person doing the C-section and then taking you to surgery, having to take a few days off because
Yes.
it had that big an effect on her emotionally, and also on the others who will never forget this case.
Right.
Um, what are your observations of that, and how you've been through a lot, but how they have dealt with that in a medical practice where they continue to see emotionally trying things?
I cannot, honestly, it cannot be easy. I mean, that's an obvious statement, but even the seasoned doctors, I won't name names, but when I got up from that coma, I saw, a handful of them, not openly weeping, but with tears in their eyes, happy to see me still alive. I definitely know, there were doctors who were headed home, stopped their cars, and had to immediately drive back to the hospital when they got an alert that I wasn't okay. Like I had a team of folks that really cared. And and I know it was stressful for them. I know it was, especially for the core groups that of folks that weren't just kind of floating in and out, but the ones that saw me every day. It was a roller coaster for them too. And I knew I had fighters, and I think for them it was so rewarding when everything got more organized and I started to do better. It was like it was really special. I just, it was like their energy got lighter as like the weeks went on and I started to like get to go home. I mean, it was just amazing. But I know they brought it home, you know, I know they did.
So you have spoken a lot very publicly and happily for everybody to hear it, because this is an important story to hear about your own journey. It's interesting as I think through this. I didn't plan to ask this, but as I think through this, it's almost for the physicians and the medical staff involved a case study of how to turn a difficult case like this around. I don't want to say you're just a case, you're a person.
No, it's true. You're not
How
wrong.
to how to how to take the chaos and organize it in a way that's going to lead to success, and probably could be a great case study for chief medical officers in hospitals to use as a way to train their staffs. You probably haven't gone there because you're busy.
Yeah. I'd be
Yes.
happy to. I'd be happy to. I mean, I did write a book, so we'll see if that also comes out. But I also just, I'm not saying it also was like perfect and seamless after. I think, oftentimes I'd have a new internist come in who's in charge of my care who didn't know me before. And it was sometimes hard to, especially later on when I started to get better, someone who hadn't seen me at my worst and didn't have a comparison, because there was the point I mentioned I had uremia and I felt it coming on. My labs I would say this. I'm not a large lady. Like I'm a kind of a 5'2". I was pregnant, but but my labs were not my creatinine versus maybe your creatinine, the effect would have been different. And so even though on paper I looked like I should have been okay, I was having uremia and it was manifesting neurologically and I was having extreme like tics. And I do know like at one point I was just saying, something is very wrong.
Right.
And this new internist was basically like, oh, you're probably just stressed. The psych department thought I was just stressed. And I was a little like, well, I've kind of been stressed.
Right.
So, but it did get to a point where I started to have aphasia. And then I couldn't advocate for myself, and my husband kind of had to take over. But I did have my hematologist who was like, she needs to be dialyzed. And I had, all these different doctors being like, when the one doctor was like, no, she doesn't. This is just this. So, it's not always perfect, but I did find that even amidst that experience, um, I was able to then get my care faster. But then they also started to trust me after that, listening to me, when I was like, this is wrong, this is off, this is new. That's a valuable thing to also know that your patients are also part of the process too. And, I could tell something was new and wrong and different. So, I think that was the third piece that eventually came in. First, they got cohesive. And then it was like, well, now listen also to me because I have information that's important, just in my own, because I'm an expert of my own body. I don't know how my TMA is doing, but I can tell you that I can't talk,
So an interesting perspective, and in the minutes we have left, I'd love to unpack that a little bit.
Yeah,
Uh, you're this was not that long ago, and in the last couple of years, you still remain a person who is identified as someone with a rare disorder,
correct.
and have spoken about that a great deal publicly, which is very important. But from your own perspective as a patient, and then sort of as advice to patients, but then also as advice to physicians, those new internists or others who may come upon you, what are sort of the best practices or the advice you would give to a patient who has something unusual and how they organize things and how they communicate, and then to caregivers who, frankly, occasionally probably put up a little bit of a guard
Yes.
when they're told, I know something you don't know, that there are those egos in my profession. What is your advice to all involved in that?
Well, I think first of all, we can always ask good questions. So if, for example, we've gone to Dr. Google, which I know every doctor partially cringes at, but you all are crazy if you think we aren't Googling. Like,
Yes.
we all just need to accept it. But instead of saying like, oh, I think this is such and such, you could just ask the questions that might help elicit more information. So we as patients, we don't want to or caregivers self-diagnose. That's a very slippery slope. We don't have medical degrees, but you can ask questions about the things we've read online. And even though I would say just ask questions, don't make assumptions. And additionally, I think for patients too, is become a good note taker, whether it's making a voice memo or sharing to your caregiver when you notice things that are new or different, symptoms, things like that, and sort of, I don't say be like a detective, but just be an observationalist and just make sure that you are keeping track of what's happening in an organized fashion, because that becomes a great tool for your physicians or your medical team. Also, too, I think having being able to communicate effectively. And I know sometimes we're in situations of stress and we're upset and gosh, the anxiety is high. But like trying to breathe and keep, calm, being able to hear our doctors. Because sometimes when you all come in, like it washes over us like a server listing off the salad dressings and we just didn't hear any of it. So remember to calm down, ask questions if you don't understand anything that the physician has said. A lot of times you all speak another language than us, and you don't always know where we're at in our. Some of us don't know what a protein is. Some of us do, like not all of us remember biology, but some of us do. So just making sure that those basic pieces of information don't just linger out there. I also say sometimes if your doctor's okay with it, ask to record what they have to say. And then you can listen again later, because I've found I'll hear one thing in the moment, and then when I go back and listen, it sounds different. I hear new things, because we're all just thinking about 1.5 million different things. And a lot of times we're perceiving everything through a filter of fear often. There's a great quote, and Eisner says that we don't see the world as it is, we see it as we are. So, in those situations, we're very vulnerable and very scared often. And finding ways to slow down time a little bit, recording is a great way to do that. And that way you can also share it with your other caregivers who couldn't be there, so they can fully understand the information. And also to just know, I think I always just assume best intentions from everyone. And I think, as you know, caregivers are not caregivers, but pretty much everyone involved in a medical situation most of the time is burnt out.
Mhm.
Like no one, whether it's the doctors or like, and oftentimes we're not expecting these catastrophes to happen to us. We didn't plan on this. We're also
Right.
burnt out. Everyone is burnt out and really just doing the best that they can. So trying to have that patience. That's why I say they call us patience for a reason, trying to have that patience. But it can also be very frustrating to have to be patient. And that part is a piece that we are all coping with.
Yeah, thank you for that. And the communication aspect from the physicians, I think we all need to be reminded. We all went to medical school to essentially learn a different language. And so we can communicate smartly with each other and occasionally impress each other with our skills in that. But when you're faced with a patient, you sometimes have to remind yourself they're only going to remember 20 or 30% of what I just said, especially if it's complicated and they're sick. So I might have to repeat it. And recording is not a bad thing. Now, none of us want to be recorded without knowing it.
That's right. That's right. You always have to ask.
Yeah,
Always ask.
that's a setup for a problem.
Yeah, always
But
ask.
but we all had that happen to us actually. But to record it, you're right, because you go back and listen, and we wonder why people didn't get it when we told them something. Well, they
Right.
didn't get it because they're not going to get all of it, and nobody would. So
Yeah, I almost wish there was, maybe if it's M-centric or whatever, there's like a pathway to help patients take home the information in a way that's even more cohesive. Like, even just knowing, like, yes, we are going to, like I said, Google it when we get home. Just send us the website you want us to look at, or provide us with something to go to. Because I do think we all just then go home after the doctors had this meeting with us, or even when or me, when I'm in the hospital bed, Googling in the middle of the night, my situation, my mortality rate, and it's a scary rabbit hole to go down. And so I think sometimes it would be amazing if a doctor was like, here's the website that you should go to learn more. Let me know if you have questions. Like that would be like game changing, I think.
yeah, and there are things like that we may be working on at M-Centric, and I know others are, and because we all have seen discharge instructions, and you've gotten them, and they are largely useless because they don't tell you what you really need to know. So yeah, driving someone to the right information sources is a great thing. So you're thriving as best I can tell, and we're all very happy about that. What do you spend most of your time doing now?
Well, I
Besides
will I will
computing?
say, just to give you an update. So, for example, even 2 years later, I would say I still have about stage 3 kidney disease, but it's amazing how far I've come. I went, at my lowest, my creatinine was 8 to now, which is like 1.3, which is an astounding journey. I was on dialysis about 9 months before I got to quote unquote graduate from dialysis without a new kidney. So I'm doing really well. I still get infusions every 8 weeks to keep my body from murdering me. But, I think life is different for me, I will say. I don't have the energy I once had. I feel like my autonomic nervous system was knocked for a loop, so I get dizzy a lot. but but I do incredibly well, and I'm incredibly grateful for the amount of healing that my body has done. And I'm so grateful for all my doctors to help me get to this amazing place. I think now for me, it's interesting. I feel like this kind of experience, like, it just changed my entire life. Like, almost dying a handful of times will do that to a person. And I do think, for me before, I would always say that I didn't have a purpose beyond my own ambition. And now I feel like I'm really motivated to try to help empower patients to get best possible care, and also support. I really do love being on this podcast because I really want to help medical professionals work at the top of their license, and really sort of, also have the stamina to keep this up. I think really it's so important what you're doing. And, the mental health involved. I'm actually friends with a chaplain at Cedars, actually. And her work isn't just for the patients. The spirit of the physicians and the medical staff is also a part of her charge. And that's, I think, again, I would love to see less burnout for doctors. And how do we get there? I know you're on that journey, and I'm really like, how can I help? Honestly, email me. How can I help?
Well, thank you. And thank you for spending the time with us. And thank you for being willing to share with us and with many, many others a very personal and no doubt very difficult story that is doing a lot of good for a lot of people. So if I can easily find you using the Google machine, but where should people go to find out more about the work you do along this journey?
Absolutely. You can definitely find me on Substack. I write a lot there at Rare Disease Girl. Also Instagram. I'm posting all the time, and maybe in a few silly videos here and there on TikTok. But yeah, and I think one final thing I just would love to say is, like, again, I commend you for this work, because the thing that I try to remind people of in my advocacy, everyone at some point will be a patient. And if we don't take care of this system, we're not taking care of humanity, essentially speaking. So it's vitally important that we take care of our medical system. And I would love to see more advocacy in that direction. So let's take care of our doctors and medical staff.
Thank you for that. And that's a very powerful message to end on. So Taylor, thank you very much for taking the time to speak with us today.
Thank you. Thank you for having me.
And thank you for joining us in this installment of our M-centric podcast series, The Shift Report. And special thanks to Taylor Coffman for sharing her important insights. For more content, networking, and innovation in the world of emergency medicine, please visit mcentric.org.